How to cool. Main techniques we're going to use are, number one, cold saline. Approximately 2 liters or 30 milliliters per kilogram IV normal saline. Easiest way to do it is to take a bag of normal saline, drop it in a bucket of ice water for approximately 20 minutes. Best thing to do is, if you think you're going to be doing it, when you hear the call in, is to drop a bag or two of saline in the ice water just in case you need it. Don't want to do this in patients who are active congestive heart failure or dialysis dependent. They haven't found that patients who have a history of CHF are going into failure from this, partly because when you get cold, the cold itself induces diuresis and helps to prevent that. When you infuse it under a pressure bag as fast as possible. And the second thing is cooling blanket. We now have the one where it wraps around the legs and the torso. The leg one, both of them go through one unit. One tube comes out of the machine, goes into one leg. The next tube goes from one leg to the other, and then the final tube comes out the second leg back to the machine as one circuit. Then that way the second circuit or openings are available for the torso unit. You can set the temperature to 34 degrees on the machine. It's very simple. Third thing is ice packs. You can pack the axilla and groin. Don't place ice directly on the chest. And the fourth thing, if it's needed, is to do gastric lavage. This is mainly going to be used in patients who are in acute CHF or dialysis who cannot get the cold saline. You put 250 cc's of cold water in for 5 minutes and then suck it out, or you can do 500 cc's and then wait 10 minutes and remove it. Monitor temperature closely to avoid overcooling. Here's a picture of the old style blankets. We now have the wraparound ones. Place a sheet between the patient and each blanket to prevent soft tissue injury. Initially set the cooling machine to the rapid automatic mode at 34. Once you're at 34, you can dial it down to 33 on the gradual cooling mode. Once your target's obtained, you can stop the saline infusion, stop the ice packs, and just use the blanket. Pat any bony prominences because they're more susceptible to pressure sores when they're cold. They're going to get the same DVT, aspiration, ulcer, sliding scale prophylaxis as in any other patient. You can give pressors if their mean arterial pressure is less than 65. If they're hypertensive, the initial treatment of choice is IV nitroglycerin drip. Document the temperature and neurostatus at least Q2 hours. Document urine output Q1 hours. And as far as labs go, we're going to skip over this. We're going to talk about how long to cool. Once their target temperature is reached, the 34 degrees, 24 hours is our protocol. Different studies have used between 12 and 72, but 24 is the most common one used. Reasons to abort cooling: if they're having a significant bleeding or if the family decides to withdraw care. Rewarming starts 24 hours after reaching the target temperature. The same cooling blanket turns into a warming blanket. You go up half a degree centigrade, approximately 1 Fahrenheit, every 1 to 2 hours. Once their temperature reaches 36 degrees centigrade, you can stop the paralysis, allow them to shiver. Remember that the cooling causes a diuresis, and then when you rewarm them, they get vasodilatation. So often you're going to need to give them IV fluid replacement to keep them from getting hypotensive during the rewarming phase. And watch for hyperkalemia, so don't be infusing any potassium-containing fluids unless they're already low. Hopefully when you're done, you'll have a happy snowman. Thank you for listening. Bye-bye.